in the air. I need 8 hands in the air. All right, Willie, do you have 8 hands?
3, 4, 5, 6, 7. I can't see all of them because I only see. I can't see Michael's. That's it. Put it the other way. Yes. 1, 2, 3, 4, 5, 6, 7, 8. Okay.
Thank you, everybody. On December 17, 2002, I had a mild stroke. Again, on June 2nd, 2003, I had another stronger one. At 29 years old, I had more in common with my grandparents than I ever wanted to imagine. Why? I had an unknown heart condition called a patent foramen ovale. My goal is that today, that each of you will go away with a better understanding of this condition, how it may contribute to strokes, and the treatment that's available. That's why I like to explain a little to you about this somewhat common condition. As a former U.S. Navy hospital corpsman, LPN, and patient, I feel compelled to educate you about the true nature of the anomaly. To do so, I want to concentrate on 3 things. The first is to describe to you exactly what a patent foramen ovale, or PFO, is. Secondly, I will show you how PFOs relate to strokes. Lastly, after connecting the condition, I want to talk to you about ways of finding and treating the PFO. Now let's begin to talk about those points. First, a patent foramen ovale, or PFO, is an open flap in the wall of the upper heart chamber of the heart. In the womb, the baby doesn't breathe, so the opening speeds the blood circulation from the right side of the heart to the left side of the heart, bypassing the lungs as it goes. Per information provided by the Cleveland Clinic, during the trip, mom is providing the oxygen-rich blood needed to sustain the life of the infant until it's born. For now, the opening is called foramen ovale because it's meant to stay open. In the first 1 to 2 years of life, the flap is supposed to seal shut. When this doesn't happen, it is then said to be a patent foramen ovale. PFOs are said to be present in as much as 25% of the population today. However, PFOs actually normally don't cause symptoms. The Mayo Clinic on its site does note that in rare cases with infants, cyanosis or blue skin may happen with certain maneuvers. However, this usually means more than one very serious problem may be present. In fact, the site also mentions that PFOs in this case may act as a life-saving maneuver or mechanism with these infants. For adults, however, this is usually not the story, which leads me to my second point. Although there may usually be no symptoms with PFOs, it is commonly found with the presentation in adults of stroke-like symptoms, actual strokes, or migraine headaches. However, for today's presentation, we will concentrate on strokes only. The main reason PFOs are said to be related to strokes is a term called cryptogenic strokes, or strokes of unknown origins. It's because it is believed that small blood clots that normally would be filtered out by the lungs as the blood travels through the circulatory systems are instead shunted directly to the brain through the PFO in the heart. This allows the clot to go to the brain and cause a stroke in the individual, especially in these otherwise young, healthy individuals that are having these strokes, such as myself. The incidence of PFO-related strokes is increased when accompanied by something called an atrial septal aneurysm. Separately, these conditions are basically not very worrisome. However, when put together, as in my case, they have strong stroke potential. I'm not trying to assume that PFOs and atrial septal aneurysm should be looked at as causes of strokes. Actually, they are considered only risks. In fact, an article in the 2001 New England Journal of Medicine felt they were strong enough together to require special treatment beyond the initial stages. And with that mention of treatment, I'd like to move on to my final point. When PFOs are suspected, there are certain diagnostic tests needed. Upon discovery, there are different treatment options available. Although several diagnostic tests may be run, the general tests that will find the PFO usually include a color blood flow Doppler, ultrasound, saline contrast study, commonly called a bubble study, and a transesophageal echocardiogram. Positive results from these tests will lead the team to come up with a treatment plan for significant defects found. Most people don't actually need treatment. However, when needed, treatment initially is aimed at non-surgical options. Methods may include full-dose aspirin, anticoagulant treatments such as warfarin, or possibly a combination of the two medications. When this does not work, doctors may consider closing the opening, usually to prevent recurring strokes such as mine. The latest procedures allow for minimally invasive closure procedures. Cardiac catheterizations can be used to implant plugging devices to the opening within 2 to 3 hours and require minimal recovery time. This was my method of treatment used. And with that snip snip, I was on my way to recovery. So there you have it all, everyone. You now know what a PFO is, how it relates to strokes, and how it's diagnosed and treated. After today, I hope you realize that although PFOs can cause increased stroke risk in some persons, the majority of persons won't know they ever have it. And if discovered, plenty of medical intervention is available for treatment. As I come to a close, I want to educate you on simple ways to watch for signs and symptoms of stroke that may not only save a person's life, but also their quality of life. Just remember this: act fast. F is for facial droop, arm is for arm drift, S is for slurred speech, and T is for time. Time is of the essence. If you see any combination of these symptoms, call 911 immediately. If you have any other questions about the symptoms that I talked to you about, or strokes in general, please go to www.stroke.org. Thank you for your time and attention, and I hope you have a great day. Thank you.